Hello friends. So this video will going to be the last video of Mycobacterium tuberculosis, where we will going to talk about directly observed treatment short course. So let's get started. So why who develop a, because in previous video I have already told you that this directly observed treatment short course is recommended by who. So why who develop such kind of course? So the reason is because we have talked about that Mycobacterium tuberculosis have developed the multi-drug resistant Mycobacterium tuberculosis, which is showing resistance to isoniazid rifampicin along with other first line drugs resistance, right? And we have also talked about extensively drug resistance, which show resistance to isoniazid rifampicin and any of the fluoroquinolones along with any of the three second line injectables, right? Amikacin, capreomycin and kanamycin, right? So why is such type of drug resistance bacteria emerge? So upon research it is find out that the main reason of drug resistance is the negligence of the patient. Okay, why? Because when patient feel that yes, I am getting or I am feeling well, they stop their prescribed course, right? And also they sometimes start to take antibiotic without any previous prescription or without any recommendation by the doctor, and that is why bacteria get the chance to develop resistance. Okay, so by looking all the situation who develop a special type of treatment especially for Mycobacterium tuberculosis, that is directly observed treatment short course. As its name suggests, here healthcare provider will observe the treatment directly and do a assessment of the treatment result. So these dots have 5 main objectives. So these dots have 5 main objectives. One is, first of all, the government should be committed to establish a centralized system of TB monitoring. Then in the TB monitoring there will be infrastructure for acid fast staining, that is detection of the TB by sputum smear microscopy. The third point is very important, that the 6 to 9 month treatment that we have talked about yesterday, that the drug regimen of Mycobacterium tuberculosis, this 6 to 9 month of the standardized treatment will be observed live by healthcare workers. Okay, and standardized repeating and recording system will allow doctors to make an assessment of the treatment result and the drug supply. These 5 objectives fulfills the main motive of directly observed treatment short course, to ensure that there will be no chance for the emergence of drug resistance. Okay, so what are those 5 objectives? First one is commitment of the government to establish a centralized TB system, right? That is TB monitoring system. Second one is the detection of the TB by sputum smear microscopy, that is acid fast bacilli staining, right? And the third one is standardized treatment for 6 to 9 months, which will be observed live by healthcare workers, right? The number 4 objective is the standardized recording and repeating system, which is used for the assessment of the treatment result. And the last one is drug supply. So that is the end of the video, where we have discussed about directly observed treatment short course.